Have you ever had a blood test and wondered who generates those results? Behind almost every diagnosis, anemia, diabetes, infection, malignancies, there's a medical laboratory team that produces the data that clinicians rely on for decision making. Welcome to Pathology Professionals, a channel dedicated to medical laboratory science students, early career professionals, and anyone curious about the diagnostic world. Whether you are starting your journey or re engaging with the profession, this space is where we explore medical laboratory science in depth. Let's begin with the most fundamental question: what is medical laboratory science? Medical laboratory science is the regulated healthcare profession responsible for the investigation, analysis, validation, and reporting of biological specimens to support clinical decision making in the prevention, diagnosis, monitoring, and management of diseases. In most countries, medical laboratory scientists are recognized healthcare professionals who must meet the defined standards of education, competence, and ethical practice before being registered to practice. This profession is not simply just running samples. It's about transforming biological material into accurate, reliable, and clinically meaningful information that clinicians use to help them treat patients. Medical laboratories are divided into specialized scientific disciplines. Let's take a look at the most common disciplines. Let's start with my favorite discipline, hematology, which focuses on the cellular components of blood: red blood cells, white blood cells, and platelets. Information regarding all three cell lines are determined using the FPC test. A specialized branch of hematology is coagulation or hemostasis, which investigates the body's mechanism of clot formation and clot breakdown. Tests such as INRs, activated partial thromboplastin times, and D dimers provide insight into bleeding and thrombotic disorders. Transfusion science, also known as blood transfusion or blood bank, is the lab that ensures compatibility between donor blood products and recipients. It includes blood grouping, antibody testing and identification, cross matching, investigation of transfusion reactions, and blood component management. This department carries significant patient risk and demands absolute attention to detail, as errors could be catastrophic. Clinical chemistry involves the measurement of the chemical constituents of bodily fluids, such as urine and blood. It encompasses routine biochemistry, endocrinology, toxicology, and immunohistochemistry. Although it is highly automated, it requires understanding of analytical principles, method validation, and interferences. Immunology focuses on the immune system function and dysfunction. Tests can include autoimmune markers, allergy testing, infectious disease serology, and antibody detection. It requires careful interpretation with clinical context. Microbiology investigates infectious diseases caused by bacteria, viruses, fungi, and parasites. It includes culture and identification, staining and microscopy, as well as antimicrobial susceptibility testing. Microbiology labs operate under strict biosafety standards. Molecular diagnostics investigates diseases at a DNA and RNA level. It includes techniques such as PCR, electrophoresis, sequencing, ELISA, and blotting. This discipline has expanded drastically with advances in technology. Histology focuses on tissue structure. Biopsies and surgical specimens undergo fixation, processing, embedding, microtomy, and staining, including specialized stains and immunohistochemistry. Histology laboratory professionals prepare high quality slides that are interpreted by anatomical pathologists for diagnosis. Cytology examines individual cells rather than whole tissue structures, like in histology. Testing includes cervical screening, fine needle aspirates, and bodily fluid cytology. Cell morphology is assessed to detect precancerous changes, malignancies, and inflammatory patterns. The laboratory is not a single person job. It is a structured professional partnership. Phlebotomists collect samples, ensure correct patient identification, select the appropriate collection tubes, and maintain sample integrity. Phlebotomy training is typically certificate based with competency sign off by an appropriate supervisor. Medical laboratory assistants receive and prepare specimens, perform data entry, and support laboratory workflow. Their training is often certificate based with workplace competency assessments, which are overseen by an appropriate supervisor. Medical laboratory technicians, or MLTs, perform routine testing, operate analyzers, and work within defined scopes under professional oversight. Training typically involves a diploma level qualification of approximately 2 years and registration with the appropriate governing council. Medical laboratory scientists perform complex diagnostic testing, validate and release results, interpret quality control data, troubleshoot instruments, ensure compliance with accreditation standards, and contribute to the quality management system as well as training of the medical laboratory assistants and technicians. To become a medical laboratory scientist, one typically requires a Bachelor of Medical Laboratory Science degree or an equivalent qualification approved by the regulatory body, clinical training or internship, as well as registration with the regulatory body in the country of practice. A pathologist is a medical doctor who specializes in pathology. They interpret laboratory findings, correlate results with clinical information, and provide diagnostic oversight and authorize specialist reports. Pathologists complete a medical degree followed by specialist pathology training and registration with the regulatory body within the country of practice. Running samples does not define a medical laboratory professional. Scientific thinking does. A scientist questions: does this result correlate clinically? Is there pre analytical error? Is quality control acceptable? Is there analytical interference? Should this result be repeated, diluted, or escalated? Does this result require pathologist consultation? Medical laboratory science is grounded in analytical integrity, quality systems, and patient safety. Let me know in the comments what's your role in the medical laboratory and what is your favorite discipline. In the next video, we will break down the total testing process and examine where laboratory errors most commonly occur. Welcome, pathology professionals. Please like and subscribe to stay up to date with all things medical laboratory science.